in positivity that earnestly began mid-March. While a small increase has cropped up since that time, again, there has been no dramatic surge. And Dr. Caine will go over the details in just a moment. But I would be remiss if I didn't take this opportunity to again urge all residents over the age of 16 to get their vaccine and to get their shot. I realize that for some residents, this is a matter of inconvenience with work and transportation and other demands. I understand that it can be difficult to fit it in. Fortunately, it has never been more convenient to get the vaccine than it is right now. Many of the clinics in Marion County currently have walk-in availability without appointments being necessary. This now includes the Marion County Department of Public Health and their East Side Clinic, which is open until 7 p.m. on Wednesdays and Thursdays, as well as from 9 a.m. To 1 p.m. on Saturdays. And all of this is an effort to accommodate those who cannot get away from work in any kind of timely way throughout the work week. And thanks to our partnership with Indigo, the 87 bus route has been slightly altered to take you right to this Marion County Department of Public Health clinic and drop you off right at the front door. They offer the one-shot Johnson & Johnson vaccine, the same vaccine that both Dr. Caine and I received in March, and as well as the two-shot Moderna vaccine. You can also pre-register to ensure availability, and that's for any resident, age 16 or older. Finally, before handing it over to Dr. Caine, let me just say one last thing to encourage those who are still hesitant or frankly may even be indifferent because they don't feel personally at risk. The reason we get vaccinated isn't just to protect our own health. Let me say that again. The reason why we get vaccinated is not simply to protect our own health, although that is what we will be doing when we do get vaccinated. We're protecting our own health. By getting vaccinated, however, you become a COVID roadblock, protecting your neighbors who may be at high risk of serious illness or even, God forbid, mortality. You're protecting your family, your friends, and your neighbors. When it comes to the spread of COVID, we're all a link in the chain, and getting our shots keeps those around us safer and healthy. So with that, let's hear from Dr. Caine.
Thank you, Mayor Hogsett, and good afternoon. We're pleased to announce that we're able to slightly relax some of our restrictions as a result of the new CDC guidance issued for outdoor activities last week. Much like these new guidelines, our ability to relax these restrictions in our new public health order is possible because of the COVID-19 vaccine. I simply cannot overstate how important the COVID-19 vaccine is as we all seek a return to a sense of normalcy. It is our best protection against hospitalization, death, and so-called long COVID for ourselves and for our families. By reducing the rate of transmission, it gives the virus less chance to mutate and turn into more variant strains, shortening the length of this pandemic. And the more people who are vaccinated in our community, the less likely we are to see further outbreaks and the need for retightening of restrictions to slow the spread. So the COVID-19 vaccine, it is our route to freedom and more safety. So at the Marion County Public Health Department, we're continuing our work to improve access and provide choice for our neighbors. And as Mayor Hogsett just mentioned, we're now accepting walk-ins at our East Side Vaccine Clinic, made possible by Indigo. Tuesday through Saturday, residents who are 18 and older can head to our 9503 East 33rd Street. 9503 East 33rd Street. And you can choose between the Moderna vaccine or the one-shot Johnson & Johnson vaccine. But I'm also happy to announce that residents 16 and older, they can likewise walk into our West Side Clinic at 3685 Commercial Drive. 3685 Commercial Drive. And this is where we have Pfizer and Johnson & Johnson are both being offered. So now pre-registration is available at our shot.in.gov, or you can call 211. It's still being recommended. And now let's talk a little bit about the Johnson & Johnson vaccine for a minute. You remember the FDA and CDC, they did the right thing by pausing this J&J vaccination until we could learn more about this rare adverse event that occurred in 6 of the nearly 7 million recipients. Now, this COVID vaccines have undergone and will continue to undergo the most intensive safety monitoring in United States history. And catching this 1 in a million event is proof that this system is working. Now, although the risk of getting blood clots from this vaccine is extremely rare, be aware of the signs of a potential adverse effect if you receive the vaccine. If you experience a severe headache, abdominal pain, leg pain, and/or shortness of breath, contact your healthcare provider and make them aware of your recent vaccination history. But even still, we know that the benefits of receiving the Johnson & Johnson COVID-19 vaccine far outweighs the risks. The mayor and I received the Johnson & Johnson vaccine along with our president of City Council, Vop Osley. So I remain very confident in saying that all 3 of the vaccines authorized in the United States are safe, highly effective at preventing severe illness from COVID-19. So it is critical that we continue to make this one-shot option accessible to this community. Now, additional pop-up clinics and special vaccination events at our clinics are continuing to be planned, like the vaccine event that just took place this past weekend in partnership with the Omega Psi Phi fraternity. And I want to thank you to our local brothers for helping to vaccinate over 100 neighbors during that event. And we're currently working to analyze the grant applications we received for the COVID Community Recovery Grant Program. Mayor, you'd be surprised at the amount of requests that we got. But I want to thank you to all of the organizations who applied. We're eager to get to this funding into our neighborhoods, and we will have further updates on this very soon. But now let's take a look at our current data to Marion County. If I could have the first slide, please. So as this highlights on this graph, we are looking very similar as a trend for our COVID-19 cases, very similar to the pattern that we're seeing in the state of Indiana. Next slide. When we look at the number of people, individuals in our community, and looking at the percentage of those, percentage of COVID-19 tests that are positive, we're right now at the level of 5.1%. And remember, our gold standard is 5% or less. So as you can see, we're seeing a very slow decline of reaching that gold standard. Next slide. When we look at our other standard that we have, looking at newly confirmed cases for Marion County, we have been seeing a slight increase in our number of cases since April the 26th. But it looks like it may be plateauing, but we will have to monitor that very carefully. Next slide. With our ED visits with individuals and patients with COVID-19 symptoms, we're also seeing a slight increase since April the 26th, where we're averaging now about 31 patient visits a day with patients experiencing COVID-19 symptoms. Next slide. In terms of hospitalizations, though, for persons who are COVID-19 positive, that has plateaued, and we're having about an average of about 9 hospital admissions a day related to someone who is diagnosed with COVID-19. Next slide. And we're still doing with significant benefit of averaging no more than 1 death a day related to our COVID-19 situation. Next slide. So how do we compare in terms of our cases across the Midwest with some of the other larger metropolitan cities? So we're experiencing 16 new cases per 100,000 up through May the 2nd. And of the cases that have really exploded in the Midwest happens to be in Detroit, with experiencing at least 50 new cases per 100,000. But we are slightly better than Chicago, who's experiencing 20 cases per 100,000 residents per 7-day average, and kind of comparable to Columbus at 14, Milwaukee at 14 cases, and Louisville at 13 cases per 100,000 in Cincinnati. So we're sort of like in the mix, but very fortunate not to be in Detroit. Next slides. So how do we fare when we look at our surrounding counties? So you can see by Marion County, we're having 18 new cases per 100,000 residents in our central Indiana counties. And Marion County, we have 18 cases. Hamilton County, we have 17 cases. And Hancock has the highest at 22 cases per 100,000 residents. But you can also see that Boone County, Hendricks, Morgan, and Shelby County and Johnson County are at a lower number of cases compared to both Marion and Hamilton County and Hancock. Next slides. So what's happening with the age distribution of our confirmed COVID-19 cases per month? We've seen a little jump in our cases between the ages of 0 to 19 years of age. And as I will highlight a little bit later, we're seeing a substantial number of cases in our high school group, especially those ages of 14 to 17 years of age. And so We're trying to monitor and watch that very carefully. We continue to see the nearly 50% of the cases in the age group between 20 and 39 years of age. And then the next group at about 25% between the ages of 40 to 59, with tremendous reduction of our cases in our seniors over the age of 60, which I contribute significantly to the fact that we have our highest vaccination rates in that particular age group. So you can see how very effective our vaccinations are in reducing and contributing to our COVID-19 cases per month. Next slide. And this is the slide that highlights that since April the 15th, we have seen in our high school group a substantial increase in the number of new cases per 100,000 residents by age, where it was less than 20 cases at the beginning of April, but now all of a sudden seeing this significant incline related to our high school group, which we are attributing it to. We're still doing our analysis and our investigations, but it looks like it's being attributed to probably most likely our spring break activities that have occurred, and we're now seeing a rise in that particular age group. Our adult age group is remaining very stable at less than 20 cases per day, with 18 cases averaging currently. Our middle schools are averaging at 13 cases per 100,000 population. And of course, our elementary and our less than 5-year-olds are being stable in terms of new cases occurring in our community. So, but the one we will have to continue to be very cautious about and monitoring are our high school students. Next slide. Well, we're almost getting there now. We are 26% fully vaccinated as of May the 2nd, okay? So we're making some of our milestones, and so we will continue to have to be very aggressive about getting people vaccinated so that we can slowly return to our normal activities. Our next slide. So when we look at percent of populations fully vaccinated based on the counties, you will see that Hendricks and Hancock County has the highest vaccination rates at 37%, followed by Hamilton County of the population fully vaccinated at 36%. And then Morgan and Marion County were roughly respectively 26 and 27% who are fully vaccinated, followed by Shelby County at 21%, Boone County at 23%, and Johnson County at 19%. So we are about a quarter, 25% away, almost a third away of being fully vaccinated in Marion County. So we have our work still cut out for us. Next slide. So this highlights, if you look at it by the age group, you can see that for those 70 to 74 have the highest vaccination rates at 73%. Even our 65 to 69-year-olds are 65% vaccinated. And remember, that has contributed significantly to the low number of cases we're seeing in the individuals 60 and older because of that high vaccination rate. And the younger we get, the lower our vaccination rates are. So if we looked at our 35 to 39 years of age, only 20% have been vaccinated. And even in our 40 to 44-year-olds, 27 have been vaccinated. So we're looking to really significantly improve on those numbers for that particular age group. And we're also awaiting Pfizer's probably new authorization to vaccinate any young child 12 years to 15 years of age, which we hope will happen sometime next week for the final EUA emergency authorization to take place. Next slide. Now, when we look at it from a health equity standpoint of our vaccination rates, in our white residents, we are 28% fully vaccinated, compared to when we look at our Black African American population, we're at about 16% of them being fully vaccinated based on that race and ethnic group, dropping to 14.5% if you are Asian, and 12.9% if you are from the Latinx population. So we continue to have a significant gap in terms of vaccination, of African Americans being half of the vaccination rates compared to their white counterparts, and with Latino X in our Asian population just a little bit lower than the vaccination rates for our Black population. Next slide. So when we look at the percent of Marion County fully vaccinated by age group, again, you will see if you were over the age of 50, at least greater than 40% of them have been vaccinated. And if you were between the ages of 20 to 49 years of age, we are ranging in the teens to the maybe low 30s in terms of our vaccination rate. So don't forget, we have 965,000 individuals, residents in Marion County, and we're at about a 28% vaccination rate. Next slide. So the adjustments as a result of the new recommendations from the CDC for outdoor activities, we are making a change with less restrictions in our indoor and outdoor events, including sports venues and raceway events, that our outdoor event capacity now will be limited to 50%, but our indoor event capacity still will remain limited to 25%. And just want to remind individuals out there in the public that large events and gatherings will need to have contact information of their attendees to allow for contact tracing in case we have an event where positive cases are identified. I believe that should be my last slide.
I think that's right.
Thank you, Mayor.
Thank you, Thank you, Dr. Caine. All right, well, as always, media members can put their name and outlet in the Q&A box. I will unmute and call on them. With the exception, oh wait, sorry. Yeah, I see Eric Berman's having audio difficulties, but he may submit a question here in a bit. We'll start off with Erica Heron of Indy Star. Erica?
Hi, thank you. My question is about the increase we're seeing among high school age students. Dr. Caine, I know you said you're still investigating, but I'm wondering, that's about the time, April 15th is about the time that a lot of high schools brought students back full time and switched off of that hybrid schedule. I'm wondering if there's any indication that that has contributed to this increase as well.
It can make a difference, because if you're off your spring break and you have a significant number of students become positive, when they come back, they can spread it possibly in the classroom. So that's a possibility. I think maybe if I had rethought this, maybe we should have told people that once you have your spring break, no students can return for at least 2 weeks after the spring break is over. But these are things that we are learning, and so unfortunately, I think people want to go, and they've worked very hard. They've been under a structured type of environment that's a little bit not their normal activities. And so sometimes when we do our spring breaks and we travel outside of our state with different recommendations and activities, we can contract some cases and bring them back into our community.
Thanks, Dr. Caine. Our next question is from Russ Dodge of WITT. Russ?
Yes, Dr. Caine, this is a follow-up from 2 weeks ago. As I look at these numbers of cases per 100,000 and the numbers for people that have been vaccinated, obviously it continues that the younger you get, the fewer are vaccinated, and we keep hearing stuff around town and around radio stations that some of the younger adults don't want to get vaccinated. You talked about changing the message and doing some focus group research to try and come up with messages that would resonate with those demographics that don't feel they need to do it or are afraid to do it or whatever. How is that progressing at this point?
So apologize. So we're still in the process of analyzing that. We're continuing with our focus groups, trying to determine what messaging resonates. So we first had to do a focus group to try to get from them what they thought would motivate them. And so we're now in the process of have put some messages together to see if it really resonates based on the feedback we got from our initial assessment. So we're hoping to have that information and that campaign available for the younger generation, the young group, within the next 2 weeks.
Thanks, Dr. Caine. Our next question is from Abdul Hakim Shabazz from Indy Politics. Abdul.
I'm sorry, good afternoon. Mr. Mayor, Dr. Caine, question for you folks. With the way Indianapolis is dealing with COVID-19 right now, do you see any time in the near or maybe later this summer that things open back up again, mainly for businesses that are along sort of those county lines? For example, Hamilton and Hancock County are open and Johnson County is open. Because the worry is that businesses may be hurt because folks aren't going to where they are because of restrictions, instead of going across the county lines.
So, Mayor, do you want me to go first or you want to go first?
I think you can handle that question.
Okay. You know what? I'm very optimistic that you're going to see a significant loosening of our restrictions come later in the summer. I think one that's going to happen is that we're going to do a much better job in increasing our rates of vaccination, which I think is going to help. We're in the process now of trying to involve some sort of innovative incentives out there to help make it more easy for folks to not have to wear a mask or to be able to go into establishments without wearing masks. So what am I talking about here? I think that we can have some special programs out there that if you're vaccinated, we can have some mechanisms or ways for business to be able to say, if you're vaccinated, hey, you can come into this part of our business and you don't have to wear a mask. You may not have to do any social distancing. So we're trying to explore that. It's the old smoking and non-smoking days, where if you were smoking, you were in this area. And if you were a non-smoker, you could be here. So we're going to try to surprise you guys at our next press conference about some innovative thoughts that I think people can be sort of some incentives for them to help get them vaccinated.
All right. Thank you, Dr. Caine. Our next question is from Sherry Radowski of the Star.
Hi, Dr. Caine, thank you. Why you optimistically say you will definitely contribute to me?
Hey, Sherry, you're sounding like you're coming through a fan or something like that. I may have you type out your question, and we'll get to you on the next one. But it's very difficult to hear you. For now, we'll switch over to Rich Nye of WTHR.
Dr. Caine, the big event we have coming up, of course, this month is the Indianapolis 500. Any announcement today that changes anything in terms of how many people will be there and whether and how much or what situations they have to wear a mask if they're attending the Indianapolis 500?
So my understanding is that I believe the current number of spectators that they're going to have is 137,000. And I have no new information that is going to change, although that is a little bit less than 50% capacity. So I'm only currently going based on the plan that I have received.
And Dr. Caine, I want to jump in and add that.
Please, Paul, thank you.
Yep, we worked very closely with the Speedway to come up with these plans, and we believe that the science as well as the plan are the best to allow people to enjoy the Motor Speedway as well as be protected and safe here in Marion County, as ultimately our responsibility is to make sure that that's the case.
Thanks, Paul, and thanks, Dr. Caine. Our next question is from Eric Berman. It's a written question because of the sound not working. He says this is two questions, probably both for Dr. Caine. Number one, the state health department said last week they believe Indiana can reach herd immunity by the end of the year. The New York Times reported this week there's a growing consensus that it can't be achieved. Can we get to the 70% level you've discussed? And if not, what does that mean for restrictions? And then the second question is about vaccinating 12 to 15-year-olds. Are we equipped to administer to that age group? And
okay, so let me just address the first one where we're talking about the national public health experts are saying that reaching herd immunity may be an unrealistic goal. Well, I think there's a huge difference between reaching a countrywide herd immunity versus what we can achieve in our own community regarding herd immunity. And I'm very optimistic that we can be able to reach herd immunity in our own community. Nearly 57% of adults in the United States have received at least one dose of the vaccine. And so more and more people are choosing to get vaccinated every day. And I think if we can remain focused on reaching the unreached with our vaccines, strengthening that protection for our city against the virus, I think we can make a difference. And I got to remind people, each and every additional shot in their arm, the quicker we can get to that, reduces our resist for these very contagious variant strains. And so COVID-19 vaccine, washing the hands, wearing the mask, doing the social distances, it can end the pandemic. We can return to our normal activities. It may not happen for the rest of the country, but we can make it happen here in Indianapolis. Oh, and then let me talk about the planning for vaccines when children open 12 to 15 years of age. We're absolutely planning for this. We're in ongoing conversations right now with some school districts and community partners to host special vaccination events for this particular age group. So we're closely just watching the FDA's approval for this process for this age group, but we are putting plans in place to be ready when that occurs.
Thanks, Dr. Caine. Our next question is from Amelia from the Star. Amelia?
Yes, this is just a series of technical questions. So one, will you be issuing a new public health order and the outdoor bed capacity at 50%? Is that an increase from where we were previously? Or what's changed in that? And then my last question is with regards to the 500 plans, had they previously submitted some sort of plan to you all, and did it meet whatever the previous was?
So, Mark, I'm going to have to ask you to repeat it because I couldn't understand the question.
Yes. So, Amelia, that you sounded like you were talking through a fan again. I believe the last question was about if the track had submitted a public health plan and if that would be available to be shared. I believe the second question was whether or not the increase up to 50% from outdoor events was a change, and if there was a new public health order generally that would be issued. So is there a new public health order being issued? What is the specific change of that outdoor capacity? And then plan.
Yeah, and let me tell you that we are changing our public health order. And the specifics are that for our outdoor capacity for large events, that capacity has been increased to 50% based on the new CDC recent guidelines for outdoor events. So that's the difference. We're currently at 25%, but that increases to 50%. Okay. And secondly, yes, the Motor Speedway has presented some plans to us, but there's still some details to be worked out, so it's not quite complete.
All right. Thank you, Dr. Caine. And I'll say both for Amelia and for Sherry, if you do have further questions afterwards, feel free to follow up with myself or the health department. Sorry for the audio difficulties this time around. Our next question is from Leslie at the IBJ. Leslie.
Hi, thank you. I'm got a question for Dr. Caine and perhaps for the mayor. The announcement that the legislature might convene one day this month and may overturn the governor's veto of a bill that would strip authority away from local health officials like the county. I guess the reaction to that?
So I can start. So, for the last year, we've been using our local data to help establish public health orders that help keep our communities safe. We still continue to follow the science as we work to bring the end of this pandemic is within our reach, I think. And today, I think because of that science, we relaxed some restrictions for outdoor activities. I just have to say, we've been grateful to Governor Holcomb, at least I've been grateful to Governor Holcomb, for continuing to allow local health authorities to set the guidelines that make sense for their communities. Especially important in a county like Marion County because of our population and our density, which is far different from our neighboring counties. So I think that's been powerful, and we definitely appreciate Governor Holcomb in vetoing that new Senate Bill 5 that would reduce our authority of county health departments.
Yeah, Leslie, I'd add to what I'd emphasize what Dr. Caine has said, but I'd add to it that, I hope we never, ever have to endure a pandemic again. But in those times of crisis, I think it's frankly indisputable that it's better to have the experts in charge. With all due respect to elected officials, it's better in the course of a public health crisis to have the experts making the recommendations and the decisions surrounding that. And those are people who put data and science first. So I am grateful as well to Governor Holcomb for vetoing the bill. And I would strongly encourage the members of the Indiana General Assembly that allowing these decisions to be made by elected officials, as much as I respect all elected officials, we have to be humble enough to admit we're not experts. We have to be humble enough to acknowledge that we need to listen to experts. And I hope that the General Assembly would respond, therefore, accordingly.
Thank you, Mayor, and thank you, Dr. Caine. Our next question is from Tom Davies from the Associated Press. Tom?
Yes, thank you. With the continued high number of cases in Michigan and Indiana's vaccination rate stagnating across the state, how concerned are you with that mix of vaccinations not going faster in Indiana and the risk posed by greater variants? Are we in a uniquely risky position right now?
I think that you always have to have concern when you have you're in close proximity to a state that's having a significant number of cases. I mean, you can see the number of cases in Detroit, 50 cases compared to our 16, 18 cases. And people do travel sometimes, but I'm still very optimistic. I think with having these special events with vaccination, trying to look at it from a behavioral standpoint, what motivates people, and trying to increase our access and flexibility of services where we're going out to the very population we need to reach, as opposed to trying to have them just come to us all the time. I think it's going to make a difference, and I think you're going to see an increase in our vaccinations, but it's a harder sell, and it's a different age group that we have to have them understand the relevance and the importance of this in terms of not only their safety, but protecting their loved ones, their parents, their siblings, their best friends, colleagues that they've gone to work with. This is still a very serious, life-threatening illness, and a vaccination can make a difference. And some of you out there, hey, I'm a pet owner. So, take that vaccination to protect your pet, your loved one, because you can transmit it to them. So if you're a serious pet owner, okay?
All right. Thank you, Dr. Caine. We have a couple more follow-up questions, I think. First one is from Rich Nye of WTHR. Rich?
Dr. Caine, do you believe that the discrepancy of the vaccinations in the Black and minority communities in Marion County are more an issue of access or resistance to getting vaccinated?
So I'll tell you that I think initially at the beginning of the epidemic, it's probably was related to access issues. And so, we were still having people calling us left and right of different racial and ethnic minorities trying to get access to the vaccine when we had a limited supply. And we went with a philosophy of, well, we're going to try to target the folks who are most likely at the highest risk for death based on their age, but really impacted getting a substantial amount of vaccines to different racial and ethnic populations. But I also believe that we have critical issues. Like, we have a lot of our patients in the different racial and ethnic groups, whether it's from poverty, that don't have access to a regular provider. So they're less prone to receiving the education one-on-one, talking about how important and the value this vaccination is. And we have to be innovative in terms of getting the vaccine to them. So I think we're seeing probably it's a combination of one, access. The other is not so much vaccine hesitancy. It's more about, hey, I'm healthy. The younger you get, I'm healthy. Nothing's happened to me before, so I don't see why it's important for me to get the vaccine. And different cultures may make a big difference in terms of what's that determining factor why I need to get vaccinated. So I think it's a combination of both, but still, we're having people call, walk in, and get their vaccination.
Thank you, Dr. Caine. And I think this is our last one, and it's Amelia following up. I didn't get it quite right. And Paul, this might be for you, I think. Did the 500's original plan comply with county capacity guidelines, or were they given some sort of exception? They announced operating at 40% capacity, and we've adjusted to 50% capacity. So between Paul and
Yeah, I can handle that, Mark. Thank you. So as I said earlier, we had been working extremely closely with the 500 about developing their plan. And so this press conference is scheduled every 2 weeks. And as a part of that conversation with the 500, we let them know that we thought the data and the science would be allowing us to make some changes in capacity limits, and we're doing it today.
All right. Thank you, Paul, and thank you, everybody. Be on the lookout. The Marion County Public Health Department will be sending out PDFs of the new public health order, as well as the slide deck from today. And then we will see you in a couple weeks. Thanks all.